Lawmakers in Arkansas are considering new legislation that would expand access to ivermectin. It's a drug that gained national attention during the COVID-19 pandemic. The proposal has sparked heated debate across the state.
It really has. Channel 7's Daniela DeHogany caught up with lawmakers both for and against this measure. She joins us now live from the Capitol with more. Daniela.
Well, Chris, Beth, Senate Bill 189 comes after a significant increase in public interest in ivermectin, which has been promoted by some as a treatment for COVID-19, despite significant clinical evidence to support its widespread use.
Senate Bill 189 would make it easier for Arkansans to obtain ivermectin while also allowing physicians to prescribe the drug for a broad range of conditions, including COVID-19. Senator Alan Clark is sponsoring the bill, and he believes ivermectin has shown promise in some cases and that this legislation simply gives the people a choice.
I would like to make it accessible like aspirin, Tylenol, ibuprofen, all which kill people and seem to be much more dangerous than ivermectin is. We're also trying to make it safer because people are accessing it at the ag store in a powder form made for animals. It's not as pure, it's not as well mixed, and so it'd be much better if they were getting it in pill form made for humans.
Ivermectin has been proven to be an effective treatment for certain parasitic infections, but its use for COVID-19 is controversial. Opponents of the legislation say it could present health risks to patients and undermine public health efforts.
I haven't talked to very many doctors at all who think this is a good idea. There was quite a bit of a controversy with a doctor back in Fayetteville giving inmates in our county jail ivermectin without them knowing about it, without their permission, without their consent back during the pandemic. My tendency is to always try to trust the medical world and not necessarily go with what lawmakers think would be the best approach.
Some also argue that the legislation would help those in rural areas where access to certain health care options can be limited.
Ivermectin is a well-known drug, and it's been used all over the place. It's been so tested that for people to have medical freedoms to be able to take it if they feel like they need it, then they should have that opportunity. Right now, it's held up through a pharmacy, and you got to have a prescription. There's other states that are looking at doing what Arkansas is doing, which is making it, on the shelf.
Well, the bill is still in its early stages, and it remains to be seen if it will pass both houses of the legislature. For now, it continues to stir support and controversy throughout the state. On your side, live at the Capitol, I'm Daniela DeHogany.
Okay, Daniela, thank you. Channel 7 News caught up today with State Senator Justin Boyd, who is a pharmacist. He told us that while there are some legitimate concerns about ingesting ivermectin, it does have its uses.
There are not a lot of side effects, but some of the side effects that potentially exist are severe, which is why I suspect the Food and Drug Administration has made it prescription. Plus, again, it's indicated for a parasitic infection, which really requires a diagnosis.
Well, Boyd says that taking ivermectin while pregnant could lead to birth defects. The drug has also been known to show up in breast milk. Again, this bill will be taken up in the Senate Public Health, Welfare, and Labor Committee on Wednesday.